Introduction to epilepsy. What is epilepsy? Epilepsy is a neurological disorder that causes recurrent, unprovoked seizures. It is a chronic condition that affects the brain's electrical activity, leading to sudden, brief changes in behavior, movement, or consciousness. Fact: epilepsy affects around 50 million people worldwide, making it one of the most common neurological disorders. 2. Types of seizures. Generalized seizures, tonic-clonic seizures, grand mal, characterized by a loss of consciousness and violent muscle contractions. Absence seizures, petit mal, brief periods of staring or loss of awareness, often seen in children. Myoclonic seizures, sudden jerking movements, typically in the arms or legs. Atonic seizures, sudden loss of muscle strength, leading to falls. Focal seizures, partial seizures, simple focal seizures, seizures that affect one part of the brain, causing twitching or strange sensations but no loss of consciousness. Complex focal seizures may involve loss of awareness, confusion, or automatic movements like lip smacking. 3. Causes of epilepsy. Genetic factors. Some people are more prone to epilepsy due to inherited genetic mutations. Brain injury, head trauma, infections, e.g., meningitis, stroke, or tumors can lead to epilepsy. Infections and illnesses. Infections such as encephalitis, meningitis, or brain injury due to an accident. Neurodevelopmental disorders. Epilepsy can occur alongside conditions like autism or cerebral palsy. 4. Symptoms of epilepsy. Seizures. The main symptom can include convulsions, loss of consciousness, strange sensations, or behaviors. Aura. Some people experience sensations or emotions, like déjà vu, unusual smells, or feelings of fear, before a seizure starts. Postictal state. The period after a seizure where a person may feel confused, tired, or have memory loss. 5. Diagnosis of epilepsy. Medical history and physical exam. A doctor will ask about the frequency, duration, and type of seizures, as well as any potential triggers. EEG, electroencephalogram, a test that measures electrical activity in the brain to identify abnormal patterns associated with seizures. MRI or CT scan, imaging tests to check for structural issues in the brain, such as tumors, cysts, or scarring that could lead to seizures. Blood tests, to check for underlying conditions like infections or metabolic disorders that might be causing the seizures. 6. Treatment for epilepsy. Medications. Anti-epileptic drugs, AEDs. The first line of treatment, aiming to control and reduce the frequency of seizures. Common medications include levetiracetam, valproate, and lamotrigine. Side effects. Some medications may cause side effects like dizziness, fatigue, or mood changes. Surgical options. Resective surgery involves removing the part of the brain where seizures originate if medication doesn't work. Vagus nerve stimulation, VNS, a device implanted under the skin that sends electrical impulses to the brain to reduce seizures. Responsive neurostimulation, RNS, a device that detects and responds to abnormal brain activity to prevent seizures. Dietary treatments. Ketogenic diet, a high-fat, low-carbohydrate diet that may help control seizures, particularly in children. Lifestyle adjustments. Avoiding seizure triggers such as sleep deprivation, stress, flashing lights, or certain medications. 7. Living with epilepsy. Support and education. Understanding epilepsy is crucial for both patients and their families. Support groups and counseling can help individuals cope. Safety precautions. Using helmets or padding, especially for those with generalized seizures, and making homes safe to prevent injuries during a seizure. Seizure first aid. Knowing how to help someone during a seizure is important. Stay calm and stay with the person. Clear the area of dangerous objects. Do not put anything in the person's mouth. Place the person on their side to help with breathing. Time the seizure. If it lasts more than 5 minutes, seek medical help. 8. Stigma and epilepsy public awareness. Many people with epilepsy face stigma due to misunderstandings about the disorder. It's important to raise awareness and educate people to reduce prejudice. Empathy and support. Educating the public about what to do in case of a seizure and encouraging empathy is vital for helping those living with epilepsy. If you found this video helpful, make sure to hit that like button and subscribe to the channel for more health tips. Let me know your thoughts or questions in the comments below. I'd love to hear from you.